Hello, thank you for joining us for our live streaming of Vax Facts and FAQs. I am Amiris Robertson, and I am a program coordinator here at the National Kidney Foundation of Michigan. I am joined by Jacqueline, my lovely technical assistant who's working behind the scenes. She will be monitoring your questions in the comments, so feel free to send questions throughout the presentation. Next slide, please. Thank you. So today we are going to cover COVID-19, flu, and vaccines in the news. This is a segment of the presentation where we will be going over some important updates. Then we will be going over the recommended COVID-19 vaccine schedule. And then lastly, we will be going over how to monitor community COVID-19 levels and how to protect yourself and others based on those levels in your community. So first up, we have COVID-19 trend updates. So currently, around 77% of the US population has received at least one dose of the vaccine, the COVID-19 vaccine. Around 65% of the population has completed their primary series. So, regarding boosters and additional doses, of those that are eligible to receive their booster shot, only half of those eligible individuals have actually received their booster dose. And recently, two studies have come out that show the effectiveness of the COVID-19 vaccine and the boosters. So, adults who received three doses of the COVID-19 vaccine were 94% less likely to be put on a ventilator or die from COVID-19 compared to adults who were not vaccinated at all. The second study, separate from the one from the image there, concluded that vaccines provided high levels of protection for all COVID variants. However, boosters increased protection against the Omicron variant. And if you still need your booster shot, you can find booster shots by contacting your primary care physician, or you could visit vaccines.gov and find a vaccine near you. So, flu season is the next, or flu trends are the next things we're going to talk about. And with the flu season, it usually occurs in the US in the fall and in the winter, with the peak times being between December and February. But flu activity can last as late as May. So it is not too late to get your flu vaccine. And if you look at the map here, influenza activity is increasing in most of the country right now. However, the highest level of flu percent positivity is currently in central US and the southern central areas of the country. And like COVID, the flu poses great threat to those with chronic kidney disease, because people with chronic kidney disease are at a higher risk of developing serious flu complications, including hospitalization or death. And this is due to the fact that CKD weakens the immune response, which can make the immune system less able to fight off infections. So next we're going to talk about the recommended vaccine schedule and how to monitor your community levels. So those that are immunocompromised have a different recommended vaccine schedule than the rest of the population. So children who are moderately or severely immunocompromised should receive a primary series of 3 doses of the Pfizer BioNTech COVID-19 vaccine. And right now, for the age group 5 through 11, a booster is not recommended at this time. So for people that are 12 years and older, who are among the immunocompromised, they are recommended to receive a total of 4 doses of the mRNA vaccine to stay up to date. And those 4 doses include the primary series of 3 doses, plus a booster shot of the Pfizer or Moderna COVID vaccine. And so when we're talking about what it means to be moderately or severely immunocompromised, It helps to know whether you fall into this category and if you should talk further with your primary care physician. So among this group may include you may have been receiving cancer treatment for tumors or cancers of the blood, received an organ transplant and are taking medicine to suppress the immune system, received a stem cell transplant within the last 2 years, or taking medicine to suppress the immune system, or you have a moderate or severe primary immunodeficiency, advanced or untreated HIV infection, or an active treatment with high dose corticosteroids or other drugs that suppress the immune system. So this image showcases the vaccine schedule that is currently recommended for those who are moderately or severely immunocompromised, but on a timeline so that you can see more clearly for those who are more visual what the timeline and recommended schedule is. So now we're going to transition to talking about how to monitor COVID-19 community levels. So the levels of COVID-19 can be low, medium, or high. And this is determined by how many people with COVID-19 have been admitted to the hospitals in the last week, and how many local hospital beds are filled with COVID patients, and how many new COVID cases had the county had. And the classification of your community or your county may determine the protections that you may take. If you are among those who are immunocompromised, like we discussed, you may want to consider taking these additional precautions regardless of the community levels, because low risk really means that there is some risk in the community. So if you look at the image, these are the precautions that you take, and they progress based on the levels in your community. So the first one is to have a plan for your rapid testing. The second one is to talk to your healthcare provider to see if you qualify for, or if you're a candidate for any of the treatments. Wear a mask that provides you with great protection, like the N95 mask, and consider avoiding non-essential activities where you may be in a large crowd or be exposed to COVID-19. Okay, so I see we have a question. The question is, what should people do now that the community levels are low to prepare if the community levels change from medium to high? So based on the image and based on what's going on in the community, you may want to re-implement. If you stopped wearing a mask in public, you might want to implement that. You may also want to have the rapid test available, and you can order a rapid test through the government, and they'll send you two for free. And you may also want to consider the other steps on the image. So talking with your healthcare provider to make sure you're a candidate, or to see if you're a candidate for treatment, and maybe avoid large crowds or large gatherings to prevent your exposure or to lessen your chance of being exposed. Thank you for the question. Okay, great. So now we're going to discuss two questions that have been asked recently. And we can go ahead to the next slide. So the first one there is it safe to mix vaccines? Can you mix and match your vaccines? And the answer is yes, but you still have to follow the CDC recommendations. So right now, it is not recommended to mix vaccines for your primary series. So if you're among the immunocompromised population, your primary series as an adult is 3 primary doses of one vaccine. For your booster shot, then you would be able to receive any of the 2 mRNA vaccines. So if you had Pfizer, then you may want to have Pfizer again, or you can get the Moderna vaccine. If you've received J&J vaccine as your primary doses, then it is recommended and even encouraged to have an mRNA booster, which is the Moderna and Pfizer vaccines. So the second question is kind of the question we got. So we'll go ahead and kind of answer it a little bit, and I can expand a little. So what you want to do is you want to encourage the people around you, especially if you're immunocompromised, to understand that there is some risk, even if the risk is low, based on the community levels in your county. There are still some risk, and there are people in our communities that are at a higher risk than others. So really just encourage people to do what makes them feel safe and most comfortable. For example, a lot of people are still wearing masks in the grocery stores because it's a place where they feel they are coming in contact with more people at one time. So you may want to do that at your kids' sporting events, or you want to do that in the grocery store. But if you're outside and you're just going for a walk at the park, you may not do that if you feel that you're not closed in a crowd. And again, it's the respect thing. So if you know someone who's immunocompromised, maybe you want to wear a mask based on the people that you're around also. We can go ahead to the next slide. And we're wrapping it up now, but we wanted to present you the opportunity to get more information on kidney disease, the effects of COVID, and the available vaccines. So if you join us on Friday, March 25th at 12 p.m., we will be with the Sustainable Healthcare Quality and Equity Forum and the National Kidney Foundation for a webinar where a member of our scientific advisory board, Dr. Norman, will be a panelist, along with one of our program coordinators, and she's also a kidney patient, Cynthia. She will be joining as well. So we hope to see you Friday. And thank you so much for joining us for our presentation this evening. If you have any more questions, or if you're interested in learning more, or you would like some more information about the presentation on Friday, feel free to reach out to us at reach@nkfm.org, or you can visit our website at nkfm.org. And if you would like a reminder message about our next vaccine live stream, our next Vax Facts and FAQs live stream, feel free to register at the link provided on the screen. So thank you so much, and have a great rest of your night.
you